Video 15. Changing the G-tube. The G-tube needs to be changed every 3 months. Sometimes it might be necessary to change the G-tube sooner. This could happen if the G-tube size does not fit correctly, if the G-tube is not able to turn in a complete circle, or if leaking continues after following the instructions to stop it. To change the G-tube, you'll need a G-tube kit from the home care company. Check to make sure the kit is not expired. In this kit, you will find gauze or a soft, clean cloth, a plastic introducer stylet, a 6 milliliter slip-tip syringe, a 35 milliliter end-fit syringe or the largest end-fit syringe in the kit, lubricating jelly, a new G-tube, check to make sure it is the same size as the G-tube in your child's stomach, and an extension set with 2 port connectors. You will also need 2 things that are not included in the kit: a small cup of tap or bottled water, and another 5 milliliter or 6 milliliter slip-tip syringe. The kit also includes an extension set for bolus feeds, which are used for giving formula over a shorter period of time. Bolus feeding will not be reviewed in this video series. If you change the G-tube too soon after giving formula, it may leak out of the stoma or hole. We recommend that you wait at least 1 hour after giving the formula before changing the G-tube. To get ready, review all the educational materials, wash your hands. You do not need to wear gloves. If another person is available, have them help by holding or distracting your child while you change the G-tube, and make sure your child is lying on their back. To prepare the supplies, on a clean surface, open the new G-tube kit. Draw up 5 milliliters of water for a Mickey G-tube and 3 to 5 milliliters of water for the Mini 1 G-tube into the slip-tip syringe. Check with your child's healthcare provider for the exact amount. Attach the syringe to the balloon side port of the new G-tube. Fill the balloon with 3 to 5 milliliters of water to check for any leaks or drips. If there are no leaks or drips, then remove the water from the balloon while leaving the water in the attached slip-tip syringe. Apply the lubricating jelly to the tip of the new G-tube. Insert the plastic stylet, also called an introducer stylet. The plastic stylet helps to gently guide the new G-tube into the stoma. Then, set the syringe and the G-tube aside. To remove the old G-tube, using the balloon side port on the G-tube that is already in place, attach the other empty slip-tip syringe and remove the water in the balloon. Once all the water is removed, you may need to use one hand to hold down your child's stomach area and your other hand to gently pull the old G-tube out of the stoma. There may be some slight resistance, but this is normal. You can see this baby has some granulation tissue around the stoma. This is also normal. If you cannot pull the G-tube out, make sure the balloon inside the stomach is completely empty by trying again to pull more water out of the balloon port, but do not use too much force. Use the gauze or a clean soft cloth to wipe away any stomach liquid or formula. To insert the new G-tube, pick up the new lubricated G-tube and insert it into the stoma. Push the water from the slip-tip syringe into the balloon of the new G-tube. Fill the balloon with 3 to 5 milliliters of water, depending on the size of your child's G-tube. Remove the syringe from the balloon side port. Still holding the G-tube in place, remove the plastic stylet. Now, to check if the new G-tube is in the right place, attach and then turn the extension set to lock it into the new G-tube. Then attach a 35 milliliter end-fit syringe or the largest syringe included in the kit. Unclamp the extension set, then pull back on the syringe plunger to look for formula or liquids from the stomach to appear in the extension set tubing. The liquids can be clear, white, yellow, or the color of your child's formula. If you see stomach liquids or formula, push the contents back in because this tells you the new G-tube was correctly placed in the stomach. After pushing the stomach liquids back in, clamp the extension set, remove the syringe, and then turn to unlock and remove the extension set. Then close the G-tube cover. If you cannot confirm the new G-tube is in the right place, do not use it. Contact the gastroenterology clinic, also called the GI clinic, for help. If the clinic is closed, go to the emergency department. Here are some other examples of inserting G-tubes. In this example, the child's skin is healed around the G-tube site. In this example, the child has some red skin called granulation tissue around the G-tube site. In this example with a G-tube doll, you can see a Mini 1 G-tube being changed. The steps are the same as the Mickey G-tube change. Checking the balloon of the new G-tube to make sure there are no leaks. Applying lubricating jelly to the end of the new G-tube. Inserting the plastic stylet. Removing the water from the old G-tube using the side balloon port. You'll notice that this new G-tube has a balloon that needs 4 milliliters of water to fill the balloon. Remove the G-tube and insert the new tube. Fill the new balloon with the amount of water needed for your child's G-tube. Remove the plastic stylet. Follow the same steps as the Mickey G-tube to check that the tube is in the stomach. To review, attach and then turn the extension set to lock it into the new G-tube. Then attach a 35 milliliter ENFit syringe or the largest syringe included in the kit. Unclamp the extension set, then pull back on the syringe plunger to look for formula or liquids from the stomach to appear in the extension set tubing. The liquids can be clear, white, yellow, or the color of your child's formula. If you see stomach liquids or formula, push the contents back in because this tells you the new G-tube was correctly placed into the stomach. After pushing the stomach liquids back in, clamp the extension set, remove the syringe, and then turn to unlock and remove the extension set. Then close the G-tube cover. Again, if you cannot confirm the new G-tube is in the right place, do not use it. Contact the GI clinic for help. If the clinic is closed, go to the emergency department.